Let's now see phases of action potential at one point of the nerve. When action potential develops, the nerve membrane excites at one point. What happens at that point? What are the phases? What are the ionic basis of those phases? First thing, action potential from one point of the nerve is recorded by an instrument called as cathode ray oscilloscope. Commonly known as CRO, and it's an instrument which is like this. There is a tube and there is a screen. There is an electron gun and it passes, it throws a beam of electrons. I want to record the changes at one point of the nerve. I place an electrode over here, and this electrode is then connected with two pairs of metal plates, one horizontal pair and one vertical pair. So, the changes that occur at this point when the membrane excites, those changes will be taken by the electrode and transferred to these metal plates. Accordingly, the metal plates will move, and accordingly, the electron beam passing through these metal plates will also move while striking the screen, and therefore that will give you a graphic record of those changes. That's how we record action potential from one point of the nerve. Let's see these changes, phases of an action potential at one point. Basically, there are two changes. That inside becomes positive and inside again becomes its original negative potential. Therefore, if you see graphically, it will look like this. Minus 70 was the RMP. Inside it becomes positive. It reaches almost plus 35 to plus 45 millivolts. That's called as depolarization. And inside again becomes negative at that point, which is called as repolarization. Depolarization is because of sodium influx, sodium entry, and repolarization is because of potassium exit. So positive charges coming in at that point results in depolarization, and then positive charges going out, the nerve will be repolarized and it will recover back to its original potential. Let's see some more changes in this action potential, some details. One point, this point is called as threshold. You can see up to threshold the graph is rising slowly and then it shoots up. This part above threshold is called as upstroke. Part above zero is called as overshoot. Upstroke, overshoot. These are the phases of depolarization. And entire graph above zero, or rather rapid rise and rapid fall of the graph, is called as spike. So spike is a rapid rise and rapid fall. And then slowdown of repolarization, this phase, is called as after depolarization. It's a misnomer. It's actually a repolarization, but it's being called after depolarization. We will see why. And actually the point becomes more negative than original. That's called as hyperpolarization. These are the phases and their details. Before we discuss the details further, let me also tell you that there are various other ways of depolarization at various other places in the body. Various ways of depolarization. We saw one in the case of nerves, that's sodium entry. Well, calcium entry can cause depolarization at some place. Yes, that's in the heart, in the SA nodal cell. Calcium influx can cause depolarization. Potassium entry can cause depolarization. Where? The answer obviously is hair cell. You know, hair cell in the cochlea, it's surrounded by the endolymph, which has a rich potassium concentration. There is high potassium on the outside, and therefore potassium coming in at the top of the hair cell or at the base of the stereocilia. This potassium influx depolarizes the hair cell membrane, and that opens the calcium channels. Calcium comes in, and then the neurotransmitter is released at the synaptic body or at the synapse with the vestibulocochlear nerve fibers. That's depolarization by potassium entry. Example, hair cell. Intracellular accumulation of potassium. That's one more way of depolarization. It occurs at various places. For example, pancreatic beta cell. Pancreatic beta cell is one example. You know, there is ATP sensitive potassium channel in the membrane of pancreatic beta cell. Blood glucose enters this pancreatic beta cell. It undergoes glycolysis. That glycolysis generates ATPs, and then that ATP sensitive potassium channel will close. That means intracellular potassium that was supposed to go out through this channel will not go out. It will come just near the membrane. It will accumulate just near the membrane on the inside, and that can cause membrane depolarization. Various ways of depolarization at various places. Let's come back to the nerve. Our discussion relates to the nerve. Let's talk about the nerve. And before we move on, I'll ask you two MCQs at the starting point. One is related to sodium channels. Sodium channel closure occurs at what point? And the options are -70 to threshold, threshold to 0, 0 to plus 35, or at plus 35. I'm sure many of you must be wrongly believing that it at plus 35 means sodium is coming in, and finally at plus 35 the sodium channels have closed, so sodium entry stops, then the potassium starts going out. That is how many people wrongly believe. The answer to this MCQ is somewhere between threshold and 0 the sodium channels close. The question is then, how come is it then the potential still goes to plus 35? We will answer that question. Second MCQ is, potassium channel opening occurs at what point of time, or at what point? And take same four options, -70 to threshold, threshold to 0, 0 to plus 35, or at plus 35. Again, many students wrongly believe that it must be at plus 35, that the sodium channels have closed, potential has gone to plus 35, now potassium channels open, potassium starts going out. No, again that's not correct. Somewhere between -70 and threshold, potassium channels begin to open and potassium starts going out. How the depolarization still occurs, we will see now. Let's start with the process of depolarization first and behavior of sodium channels. I'll just give you an example how depolarization occurs. Imagine this. This is just an example. Imagine a football stadium. There are lots of gates to that stadium, small gates, and all those gates are closed right now. And there is a massive crowd waiting outside to enter the stadium. There is a football match. Massive crowd. Just like our sodium, which has got a concentration gradient to push into the cell. This crowd is trying to push into the stadium. All gates are closed. Now, 2-3 people, they open the first gate and they go inside. From inside they open the gate, second gate. So, 2-3 more people will go in. They open the third gate. 2-3 more people go in. They open the fourth gate. So, all gates are opening one after the other, like that. And at one point, all gates are open. And there's a passage created and this crowd is trying to push in. So now this crowd pushes in with one massive surge. You have to imagine this. And even as that was happening, that crowd was pushing in, somebody was watching from the CCTV camera. So he closes the gates instantly. And therefore, whatever crowd could enter in that one single push will come in and it will get to sit in the stadium and see the match. Now imagine this to the sodium influx and depolarization. It will happen in two phases. One is what happens from RMP to threshold. RMP to threshold. It's a positive feedback cycle of sodium channels. Positive feedback cycle of sodium channels. You see, you applied the stimulus. Initially, a few sodium channels open. So, some sodium enters. That means some positive charges enter. Therefore, membrane potential drops to a less negative value. And that opens some more sodium channels. So some more sodium enters, membrane potential drops further, and some more sodium channels open because of that. This is how the positive feedback, like those small gates went on opening one after the other. Second point is, what happens at threshold? What happens at threshold? At threshold, there is a critical number of sodium channels is open now. A critical number is open. So, since there is this critical number is open and sodium has got a good concentration gradient also to come in, therefore at threshold there is a massive instantaneous influx, surge in sodium. Just like imagine that red firecracker or any firecracker, it goes on burning and then threshold is reached and it bursts. So there is a burstful entry of sodium. With a single massive surge, the sodium will come in from that point, and therefore you can see the graph rises quickly. There is upstroke and overshoot. So inside has become completely positive now. That's how depolarization happens. But the point that you must understand is threshold. I mean, at threshold there should be a critical number of sodium channels that should be open. Then only there will be a massive influx. And so 2 points. One is, if threshold is not reached, if your stimulus was not adequate, then there is this surge of sodium will not happen and action potential and spike will not be generated. Second point is membrane accommodation that I said some time back, that sometimes threshold may be crossed and yet action potential not generated. Yes, threshold is the basis for all or none phenomenon. That if the threshold is reached, action potential becomes inevitable. Threshold is not reached, no action potential. But there is also this membrane accommodation that you have to deal with. What is membrane accommodation? Sometimes threshold is reached and yet action potential is not generated. Why? Because as we said, stimulus intensity is not just rapidly rising. It's not good enough. So what happens is sodium channels do open. Sodium does come in. But sodium channel and that positive feedback cycle is so slow, its opening of channels is so slow that sodium is coming in very slowly, but threshold is reached very slowly, but the sodium channels, critical number of sodium channels that were needed to cause this spike is just not available. It's a very slow rise of membrane potential because of very slow opening of sodium channels. That was membrane accommodation. But that was the importance of threshold in entire concept. So that was depolarization and how sodium entry occurs. Now let's see the potassium, how the potassium channels and potassium ions behave. As I said, okay, before that, let me just answer that MCQ that I asked. At what point the sodium channels close? Yes, there is a massive instantaneous influx of sodium and it is immediately followed by the closure of sodium channels. It's inactivation, but right now I am using the word closure of sodium channels. Means as the massive surge was happening and the graph was going up, membrane was becoming positive, the sodium channels are closed. So whatever sodium came in that one massive surge will take the sodium to plus 35. Okay, that you need to understand. It's not as if sodium is coming in. It's just a massive instantaneous surge and immediately followed by the closure of sodium channels. So just above threshold, sodium channels will be closed, but sodium has already entered. It will take the potential to plus 35. And therefore, you must understand that the potential can go anywhere between plus 35 to plus 45 depending upon the concentration gradient for sodium. Imagine a condition of hyponatremia. Instead of 141, the serum sodium is 131. The concentration gradient is narrowed, and that means at threshold, that massive influx of sodium, less sodium will come in. The sodium entry will be less number of positive charges will come in, and therefore amplitude of action potential will be less, it will decrease. Okay, let's see the potassium ions, how they behave. Somewhere between minus 70 and threshold, potassium channels begin to open. They begin to open between minus 70 and threshold. So, even as sodium is coming in, potassium efflux starts. Now then, positive charges are coming in and positive charges are going out. How is it then that the depolarization can still occur? The point is, sodium entry predominates. It's much larger as compared to potassium exit. So, that's why depolarization can happen. Sodium entry is much larger as compared to potassium exit. Sodium entry predominates, and therefore you must say that the depolarization, so far you have read that depolarization is because of sodium entry. Now you must say depolarization is because of net entry of positive charges, net influx of positive charges. Sodium coming in, but potassium is also going out, but sodium coming in is larger, so there is a net influx of positive charges. That results in depolarization. That's the correct way of describing the depolarization. Now my question is, what happens to the potassium? It is initially slow. Potassium efflux is initially slow. And then next, what happens at plus 35? Now sodium influx occurred and sodium channels have closed. So at plus 35, potassium efflux, potassium exit gathers momentum. Now potassium starts going out rapidly in large numbers. So the only question is, why at minus 70 the potassium exit was slow and at plus 35 the potassium exit is much rapid, much greater? We have already answered this question, but once again we will answer it, that at minus 70 if the potassium is allowed to go out, potassium exit will be slow, because minus 70 is very close to minus 90. That's the equilibrium potential for potassium. Equilibrium potential for potassium is minus 90, and that's very close to minus 70. So if the potassium channels open, potassium exit will be slow. But at plus 35 is far away from minus 90, the equilibrium potential for potassium. Therefore at plus 35, potassium exit will occur in large numbers. It will gather momentum, and therefore potassium starts going out in large numbers and repolarization will happen. Another point in this is, during repolarization we have seen two more phases. One is this slowdown of repolarization is called as after depolarization. As I said, it's a misnomer. It's a repolarization. Then why would you call it after depolarization? It's because of electrical gradient in the opposite direction. Electrical gradient in the opposite direction. Potassium exit slows down little bit. You see, potassium started going out initially in large numbers because concentration gradient was large. But as the potassium starts going out, it carries positive charges to the outside. Those positive charges get accumulated just outside the membrane, and therefore an electrical gradient got created in the opposite direction. So potassium has got a pull now in the opposite direction. So net potassium exit will slow down, and therefore the graph will slow down. In fact, when this potential was recorded for the first time, electrode was placed on the surface of the membrane, and therefore this phase was called as a misnomer after depolarization because of those positive charges. And then finally, this phase, hyperpolarization. Hyperpolarization is because excess potassium leaves. Excess potassium leaves. You see, there is a voltage gating of these potassium channels. There is time gating of these potassium channels. They are slow to open, slow to close. They are lazy channels. So they were slow to open, then they opened. Now they are slow to close. Potassium channels remain open for a long period. Therefore excess potassium leaves. In fact, what potassium is doing is, as it is going out, it is dragging the membrane potential towards its own equilibrium potential of minus 90 millivolts. And therefore, equilibrium potential for potassium in the case of a nerve is minus 90. As we saw in the case of muscle, it is minus 96 millivolts. Let's just write down the values for nerve. RMP of a nerve is minus 90 millivolts. equilibrium potential for sodium in the case of a nerve is plus 60 millivolts. Equilibrium potential for potassium is minus 90 millivolts. Equilibrium potential for chloride in the case of a nerve is minus 70 millivolts. So MCQ, equilibrium potential for which ion is closest to the RMP of the nerve? One would have thought the answer, okay, just a correction, RMP is minus 70 for the nerve. One would have thought that equilibrium potential for chloride is minus 70 and RMP of the nerve is minus 70. No, the answer should be potassium, because chloride's equilibrium potential is same as that of the RMP of the nerve. Same is not closer. The question is equilibrium potential for which ion is closest to the RMP of the nerve. The answer should be potassium, because closest does not mean same. Same does not mean closest, and therefore chloride is not the answer for this. In the case of skeletal muscle, the answer was chloride. In the case of nerve, the answer should be potassium. So that was about the nerve, and potassium equilibrium potential in the case of a nerve is minus 90 millivolts. Why are the values different for nerve and for skeletal muscle is because for equilibrium potential we take C1 upon C2, Nernst potential is calculated by C1 upon C2, and these concentrations are different for nerve and different for muscles for these ions. So equilibrium potentials will be different for nerve and for muscle. Alright. So excess potassium leaks out, and potassium then drags the membrane potential back to the equilibrium potential of its own, that is minus 90 millivolts. That's hyperpolarization of the membrane. Now two things happen simultaneously at minus 90. Very often I am asked this question that after every action potential there has to be recharging. We have seen this already, that sodium and potassium, they have to be sent back. I mean, sodium has come in, it has to be sent out, and potassium went out for repolarization, it should be brought back in. That's the job of sodium potassium pump. But sodium potassium pump is electrogenic, it creates more negativity on the inside. So if recharging starts at this point of time, the membrane will become even more negative. Sodium potassium pump is electrogenic, it creates more negativity on the inside. Right. The answer to this question is simple. Recharging starts and also leaky sodium channels start. Sodium starts leaking in again. Sodium leaking in will bring in the positive charges, and therefore from minus 90, the membrane potential will again go to its original RMP of minus 70 millivolts. These are the phases and their ionic bases, the details of those ionic bases. But what you must understand from all this is that an excited membrane, you see, we have seen 3 MCQs. Most diffusible ion is potassium for any cell. Most diffusible ion for an excited membrane, in an excited cell is nerve or muscle. Again, ion, the potassium ion, membrane is much more permeable to potassium as compared to sodium. But most diffusible ion in the case of excited cell, and when the membrane excites, is then sodium. The answer would be sodium, because as we have seen, when the membrane is exciting, that time sodium permeability is much more, and sodium coming in is much rapid as compared to the potassium exit. These were the phases and ionic bases, but the story is still not over. We need to see how the sodium channels operate. I mean, sodium channels and their gating behavior.